Depression. Depression is a mood disorder that causes constant feeling of sadness and loss of attention, a common mental disorder. Although depression negatively affects the person's feelings, thinking, and behavior, his ability to do daily work, as well as his impact on life aspects different, such as professional, social, and health, but it can be cured, and women are more likely to develop depression than men. And although depression can affect people of any age group, 50% of all people with depression have begun to develop depression between the ages of 20 to 50. It should be noted that the emotion of sadness felt during difficult life conditions is normal for every person to go through at certain times in his life, and usually the feelings of sadness are overcome over time. But if the intense sadness affects the ability of the individual to perform his daily activities for more than a week, it may be a sign of depression, and you should see your doctor to assess the condition and get appropriate psychological support and diagnosis. How to get rid of depression. Depression is a treatable disorder even in the severe stages of it. Depression can be eliminated using many different treatment options, and it can generally be said that treatment of depression depends on the severity of the evaluation of the competent doctor, and mild to moderate depression is treated with treatment psychological, pharmacological, or both, while severe depression usually requires the use of both pharmacological and psychological therapy, and if drug therapy is ineffective, brain stimulation therapy may be performed, whether it is by electric shock or transcranial magnetic or electrical stimulation. Psychotherapy. Psychotherapy, or what is sometimes called talk therapy, contributes to detecting the causes of depression, learning healthy skills to deal with and overcome them, and the most prominent types of psychotherapy. 1. Cognitive therapy. Cognitive therapy is concerned with the nature of the thoughts in mind, as thoughts can affect emotions, so negative thoughts in the individual lead to a decline in his condition, while positive thoughts contribute to improving mood, and in fact cognitive therapy helps to teaching individuals to identify negative patterns of thinking and turn them into positive patterns. Treatment sessions are usually held with a specific plan for each session, in addition to carrying out a home exercise, and the treatment is usually short, usually lasting 6 to 18 weeks. 2. Behavioral therapy. Behavioral therapy is concerned with the nature of behaviors issued by the individual, and helps to promote acceptable behaviors, and eliminate unwanted behaviors, through techniques such as linking wrong behaviors with negative results, and controlling distressing attitudes. And anxiety with relaxation techniques. 3. Cognitive behavioral therapy. This type integrates the two previous methods together, where it is concerned with addressing negative thinking patterns, wrong behaviors that increase depression, and the therapist needs to follow the daily events that the patient goes through and how he responds to them, in order to determine negative reactions automatic, and then teach the patient good thinking patterns and acceptable response methods, in addition to practicing positive self-talk. 4. Dynamic psychotherapy. This treatment assumes that the cause of depression is often unconscious internal conflicts, which may have roots from childhood, and aims to promote full awareness of all contradictory and disturbing feelings, help the patient to tolerate them and improve their image from their point of view. Unlike some other methods of treatment for depression, psychoactive therapy tends to be less focused and longer term, and is useful in building self-awareness and finding the relationship between previous life experiences and depression. 5. Interactive therapy. This treatment is concerned with the individual's past and present social life, including differences, interaction, and social support, and the treatment is often focused on important social relationships such as parents, spouses, and friends to determine the impact of this relationship on the patient's life. And the way to solve the problems. Pharmacotherapy. Antidepressants relieve the symptoms associated with the disease by controlling one or more important neurotransmitters in the brain, and it should be emphasized that these drugs should be used only as a prescription of the competent doctor, and should inform them of the history of the disease, the types of medications or herbs that taken by the patient, in order to avoid the occurrence of drug interventions. It should be noted that medications to treat depression do not cause addiction, but it is forbidden to stop taking them until after the doctor reviews the association of the sudden cessation of use to the occurrence of severe effects resulting from the withdrawal of the drug from the body, and in fact the patient is advised by not rushing the results of treatment, because antidepressants need approximately 4 to 6 weeks to begin to improve, and it is necessary to note that it is not possible to predict conclusively the type of medicine that is best for the treatment of the patient, as doctors usually try the drugs known to be the most effective and safe, but of course there is a potential disparity between the bodies in the response to the drug, and the vulnerability to side effects, so your doctor may try 2 or more medications during the treatment plan until the patient reaches the healing stage. Brain stimulating therapy. Brain stimulation therapy is used to treat severe cases of depression, especially those that other treatment options have not been able to control, where electromagnetic currents are used to stimulate certain areas of the brain, relieve symptoms of depression, and brain catalytic therapy includes several options, such as direct electrical stimulation across the skull, frequent transcranial magnetic stimulation, and electroshock therapy. Repetitive transcranial magnetic stimulation. Recurrent transcranial magnetic stimulation therapy involves placing an electromagnetic force release source on the scalp near the forehead, where the electromagnet sends a constant frequency magnetic pulse, repeatedly to areas responsible for controlling mood and depression in the brain, stimulating cells. Neurology, it is believed to activate areas of the brain that are less active in cases of depression, and it should be noted that this treatment is performed in the hospital and does not require anesthesia or analgesics during the procedure. Transcranial direct current stimulation. The treatment of direct transcranial stimulation uses a small stimulant connected to electrodes fixed on the patient's head, where the alarm sends a constant, low-intensity current to the brain, reducing the symptoms of depression by stimulating brain cells, and it is worth noting that this can be used type of treatment alone or in conjunction with other treatments. Electroconvulsive therapy. Modern electroshock therapy is an effective and rapid procedure, reducing the symptoms of the most severe forms of depression very effectively bypassing small, controlled electrical currents through the brain, under the influence of complete anesthesia, with the aim of creating a short seizure of no more than 60 seconds, during which significantly increased brain activity, and this is totally different from the old procedure, which is associated in people's minds frequently in terms of its risks and pain as a result of the use of large electrical currents without anesthesia, and the importance of electroshock therapy lies in the treatment of acute depression associated with separation from reality, or the desire to suicide, refusal to eat, and treatment-resistant depression.